intervertebral discs are thick and healthy. As such, correct spinal
I can't believe this doc is making me watch this video.
sending nerve impulses from the brain to the targeted muscles and organs.
Guys, this is actually what's happening if you're having a new patient watch a first visit educational video. And that's not just my opinion. So I'm on the phone last week with a doctor, 30 plus years, and he's calling me about the program, and he's telling me about his current relationship with a coach or some company he's been with for 10 months, and he just doesn't feel comfortable with the scripts, some of the procedures, and the new patient educational video they have his patients watch. And I asked him, your patients are really sitting in a room by themselves watching a video? And he goes, yeah. And I go, really? It's 2016. That was a revolutionary concept in 1977. That was 40 years ago. Do you know how much has changed since then? And he says, it's funny, Josh, oftentimes I come in at the end of the video and they're on their phone. And I said, yeah, and they're texting someone, I can't believe this doc is making me watch this video. Here's the thing, it's not even that they're not getting the information and the education that you want them to through that video. That's not even a concern. Here's 3 things that they are getting. They're thinking, what is in this video that this doctor can't tell me, isn't confident, clear enough to tell me himself or herself? Second, does the doctor not have enough time to tell me what's going on, why I'm here, what this care is? And 3, if it takes a 5, 10, 12-minute video to explain what I'm gonna get here, that causes some skepticism. That goes to the timeshare sale pitch mentality. If you can't describe with certainty within 30 seconds, 15 seconds, what you do and why it's better than any other option, there's an issue. So here's the reason. Chiropractic education, I am all for, but it's when and how you dispense it, not how much of it can you. And in the initial patient experience, that first visit, that second visit, whenever it is, before they commit to some type of care with you, the more education you put on, the worse it is for the relationship, meaning more skepticism, harder for them to accept your care, harder for them to trust you, harder for them to respect you, harder for them to refer other people. Now, once they're receiving your care, absolutely, there's time and place for education, and it's a whole different story. But what our profession has showed chiropractors to do, unfortunately, from an incorrect standpoint, is thinking that the more they understand, the easier they will accept. That's just not true. And now that insurance is declining and patients really have to pay out of pocket more so than ever before, it's completely an emotional decision, not a logical one. And more so than anything else will be you, the doctor's confidence, certainty, clarity, and brevity in why this is for them and what it is, very simply. And when you flip the switch and you stop talking about chiropractic and educating about chiropractic, and you make it about that person in front of you, you make it patient-centered, watch how much easier the conversations get, the care acceptance get, the referrals come, and the retention goes. So please, take this video as an impetus to get on one of my podcasts on this page, one of my webinars. Take 30 minutes to an hour. Learn what I share in one of those webinars or podcasts. You put it into your practice, you'll see a difference for the rest of your career. I guarantee you that. Thanks for watching. Go make that happen this week for your patients and your practice.